All right, we are in the last chapter of Module 12, which is Chapter 39, Promoting Oxygenation. So, again, for oxygenation, it's still the nurse's role to give oxygen to our clients who are actually oxygen dependent, or maybe they're needing oxygen therapy, right? So, just to give you a heads up, at least, because there might be some facilities that maybe they train their PSWs to give like a regular, like the ideal, or maybe the two 2 liters per hour oxygen, which is the safest one. However, ideally it's always the nurse's responsibilities. Okay, so just to give you an idea of what promoting oxygenation. Its oxygen is very essential for life and cellular functions for us to grow. Inadequate oxygen leads to hypoxia or organ damage. So that means lack of oxygen in the body or in the blood. It's also support also you, as support workers, you play a key role in recognizing oxygen needs. So that I think maybe you guys comes in. So you will identify if your client is experiencing cyanotic, or maybe they have difficulty of breathing, or maybe they're looking pale, their lips getting dark purple or something like that. So those are signs that you need to call immediately your nurse, because the client might be having lack of oxygen, right? So when we talk of oxygen therapy, it's the administration of oxygen above room air concentration. It is prescribed by a physician or a nurse practitioner. So you can just put there, as what I've told you, ideally it's 2 liters per hour if there's no order, if it's an emergency. But ideally, it should always be prescribed by a physician or a nurse practitioner. Client must only receive the ordered amount, not more than that, right? Not more than that. It should always be received the only ordered amount. So, what are the factors affecting oxygen needs? Of course, if there are respiratory and cardiovascular functions issues, maybe client has, they could be like, maybe they have like lack of oxygen due to they have asthma or anything like that. There might be some other cardiovascular functions issues, or even the respiratory. Maybe they're having a lot of coughing lately or anything like that, that maybe they're lacking oxygen and they need to be given oxygen, right? And also the red blood cell count and nutrition. It could also affect the age. Like as they grow older, our oxygen level might be a little bit low if we lack of exercise because we're too heavy or overweight. Fever also can cause or affect the oxygen needs of a person, the pain, the drugs, and even person if the person is smoking, right? So those might be some of the factors. So when we say altered respiratory functions, it means it could be a shortness of breath. It could be acute or chronic. I mean, acute, it just happened randomly. Chronic, it could be happening for all, because maybe the client has COPD or asthma disorder or whatnot, right? It could also be abnormal breathing patterns or cyanosis, like lack of oxygen in the blood or in the body, and changes in vital signs and body position. So sometimes when the client reposition themselves, they start having difficulty of breathing. So there is like a proper positioning maybe for that specific client for them to have a proper oxygen level, right? Promoting oxygenation too, it's always ideal in terms of position, semi-Fowler's or orthopedic position, right? And of course, coughing and deep breathing exercises will help also promote oxygenation. And of course, incentive is spirometry. Like it's like a tube that the client will breathe there and breathe out, right? So that is an incentive spirometry. But if I'm not mistaken, that should be also prescribed by the doctor for the client to use it as a breathing exercise. So what are the oxygen sources? We have oxygen concentrators, we have oxygen cylinders, or the liquid oxygen systems, right? So depends what the company or what your facility is using, or what has been ordered for the client. Okay? So always remember that the safety precautions for oxygen therapy. Oxygen is always flammable, so there should always be a no smoking sign outside the door of the client. So as a PSW, that's your responsibility, making sure you're promoting safety. So make sure that the sign will always be there on by the door. From heat and open flames, those cylinders, or depends what client is using. and report the hazard immediately. If you notice that maybe the client is smoking inside the room or whatnot, you need to report that. You need to tell the client not to. Plus, you need to report that to your supervisor. Okay? So, the assessment and diagnostic testing that we usually do to identify oxygen therapy, of course, there might be some pulse oximetry. The normal pulse oximetry is always 95 to 100. Below that might be a little bit worrisome, so that's why it needs further assessment. It could have been a sputum specimen collection too. We test that. We use that to check the client's condition, respiratory condition, or anything like that. And of course, postural drainage and test chest percussion, right? So test chest percussion, like the nurse or the doctor will check the sound of his or her chest or whatever, like what's the condition. We also have artificial airways and ventilation that we usually use for clients who are actually dependents, like oropharyngeal tubings, nasopharyngeal tube, ET tube, tracheostomy tubes. We also have mechanical ventilators or ventilation that supports the breathing of the person. And of course, alarm signals are always on in case those tubes are dislodged from the client, right? So it will alarm once the tube got removed from the client's body because the client only breathes because of those airway and ventilation tubings. Okay, so that's very important. Once you hear a tube, and then you know that once you hear an alarm, and you know that your client is tracheostomy or ventilator dependent, you need to run immediately. You need to call your nurse because it might dislodge, right? So you need to let the nurse know immediately. All right. So for your preference, same book, Elsevier 2022, chapter 39, Promoting Oxygenation. So that's it. That ends our theory lecture, guys. So we've done module 1 to module 12. Good luck, everyone. I would always recommend to complete all your requirements, your pending assignments and quizzes, because as soon as I start checking everything, I will submit that. I will let the admin know that I'm done, right? I'm done submitting, I'm done checking. So I'll still give you more time to finish it. And yeah, so good luck, guys, and welcome. And hopefully soon you will have your placement. Take care, everyone.